Hello everybody, my name is Brendan and I'm a psychiatric nursing assistant. I work in the NHS. I'm a bank staff, so that basically means I pick up shifts as and when required at different sections of my trust that I work for. So I may be around one section of the ward where I work with psychosis, depression, anxiety disorder, schizophrenia, all those sort of things, bipolar, and then you've got the other side where there's dementia and things like that. Those are the wards that I work on to get the experience in order to proceed with my job. Now, I have this badge here. I got it in my last job. It's events team. I was part of the events team on my last job. I just put that there to cover up the trust that I work for, just for data protection and protection of myself and privacy. So that's that cleared up. So that's why I'm wearing an events team badge. So I'm going to be reading a couple of things out for you that I've seen on here, and it is the clinical commissioning group that have organised this template, this site for us all to read in the NHS. It's an NHS official site, and what I think is important to know is that it's better to have things read to us rather than reading ourselves, just so I can help people get an understanding as to why things are happening. And hopefully this will help, because a lot of people with anxiety, depression, many other things along the line don't understand, and unless it's been read to them, a lot of people don't understand. So if you are happy to sit and listen to me while I read exactly this out, just to clarify, I'm not a nurse, I'm not a qualified nurse, I've not done a degree, I am just a nursing assistant. So that basically means I'm a carer, but a bit further down the line with a carer, I'm just not trained in medication, I'm not trained in those sort of things, but I'm trained in moving and handling, I'm trained in PMVA, which is, managing violence and aggression and all those sort of things. But a nursing assistant is not a nurse. So just to put that into perspective, I'm not a nurse, I don't do medication, but I do a lot of the other things. I do the clinical care, the personal care, and all those sort of things. So that's what a nursing assistant does. We're there when we're needed. So I'm going to go ahead and read this out. So this is anxiety, depression, and mental health. Everyone experiences feelings of anxiety during their lifetime. For example, you may feel worried and anxious about sitting an examination, so an exam at work, GCSEs or things like that, or having a medical test or a job interview. Feeling anxious is perfectly normal. However, for people with a generalized anxiety disorder, or someone with anxiety that your doctor may have told you we've got anxiety, feelings of anxiety are much more consistent and they're constant, and they tend to affect their day-to-day life, and it tends to wallow up and keep us inside and not want to speak out about anxiety. There are several conditions for which anxiety main symptom, panic disorder, phobias, and post-traumatic syndrome can all cause severe anxiety. Understanding depression. Depression is often an illness. If you're depressed, the usual feelings of sadness that we all experience temporary, remain for weeks, months, and years. They can also be so intense that daily life is affected. You cannot work normally, you don't want to be with your family and friends, and you stop enjoying the things you usually do. If you experience depression, you may feel worthless, hopeless, and constantly tired. In most cases, if you have a milder depression, you can probably carry on, but will find everyday tasks difficult. Now, I'm going to stop right there because there's something interesting I need to share. I have myself been going through depression. It's not an easy thing, and we all go through it in our own way. It's just like grieving. It isn't the same thing, and grieving, we do it in our own way. Depression, we sort of do it in our own way as well. We show these different symptoms, we show these different ways, but they usually, you can pick up with depression. But it's not a one-way street. Depression, don't assume you know everything about depression just because you've been through it, just because I've been through it. Yeah, I've been through depression. That doesn't mean I know everything there is. There's more about depression that probably scientists don't even know. So it's good to keep a lid on things that we're not so sure about, and it's good to know about the things that are really important and the things that people need help with. If you have severe depression, you may find your feelings so unbearable that you start thinking about suicide, end of life, those sort of things. Now, I have been in that place multiple times, and it's not easy to talk about. It isn't easy to talk to people about. I know that, and it's so difficult. And to get that out to somebody is so frustrating. You're telling people the intention that you want to take your life is not only makes you feel shame, but also makes you feel uncomfortable. You don't want people to know about it, and that's the worst thing you could do, is not tell anybody about it. And I know how difficult that is, and I can't possibly know what some of you are going through at the moment. And I just hope you know who to talk to, and that you know you must speak to somebody about it. About 1 in 10 of us develop some form of depression in our lives, and 1 in 50 has severe depression. It affects not only those with depression, but those around them, like family and friends. Depression is not a sign of weakness. It's a chronic long-term condition that may require long-term management or treatment. Some people only have depression once, but many people have repeated episodes. Like myself, I have repeated episodes, but I'm fine a lot of the time. But when I say I'm fine a lot of the time, this I'm fine thing is something I'm trying to get out of. When I'm actually not fine, I say I'm fine, and this is what I'm trying to pull out of. This is what I'm trying to get out of the habit of doing, is saying I'm fine when I'm not. But it does affect people around us. It does affect lives of families and friends, and people don't want them to know it's happening to them, and that people don't know how to deal with it if you've not been around that kind of ward or experience, or but it's not a sign of weakness. It isn't a sign of weakness. Even if you feel it is, it isn't. It's not. It is one of life's complicated things, and life isn't fair, and we hear that a lot, and it's because it's true. Life isn't fair, and it does throw things at us, and it does make us feel like it's not worth living, just because of how difficult it makes everything. How difficult everything seems. 500,000 miles all the way over there. How do we get to all the way over? It just doesn't add up in my brain. Just how do we get to one place to the other? But the truth is, it takes this long time. It takes such a long time, and maybe it doesn't for some people, but for me it's taking a long time. And then just as you're about to get there, you think, oh, come on, or you think, oh, I'm gonna give up now. So we withdraw, and we actually undo all the hard work we've actually put in. And that is not a sign of failure. That is not what failure is. Don't get it in your head that that is what failure is. That isn't what failure is. You haven't failed. You've not failed to maintain anything. You've not done anything like that. You've basically dropped back. But that doesn't mean you're a failure. Because even if you feel it fails, you can do more about it. So you can keep on going. It's so important that you keep on going. An episode of depression commonly involves a number of events that combine to take you into a downward spiral. Studies suggest women are about twice as likely to have depression. Now, I'm not going to read over these things because I don't think they're relevant to what I'm trying to get out the message here. I mean, I'm not trying to be, sexist or anything like that. Don't get me the wrong way. That's not what I mean. But I will read the rest of the thing. But studies suggest women are about twice as likely to have depression as men. But this may be because women are more likely to seek help, which is true. A lot of men feel they don't want to open up about things, and that is important. But I wasn't being sexist back there about women. It's just, I'm not a big believer of statistics and things that come up. It really frustrates me because I've met people on so many different scales. I cannot sit here and tell you I've met more people who are women with depression or more men who've had depression. That's just irrelevant to me. Like, if somebody's got it, help them. Don't make a statistic. And I don't like statistics. I never have. I just think it's a ridiculous way humans monitor something, and about 50% this or 25%. I don't do that. That annoys me. That is not what my job's about. I don't I don't go up to my patients and go, oh look, it's more likely that you're not going to have it because a female's going to have it. I know it's not like that, and that is just the way I interpret it as a human, but I don't like statistics. I'm not a big lover of the statistics. So depression is complex, and the risk of developing it may increase if you experience a stressful life such as bereavement or a relationship breakdown. Now, a lot of mine was related to aggrievement around losing my grandmother rather recently in April last year. Now, I know what a lot of the young people out there say that's a long time, and well, it's not. In the stage of grieving, that is not a long time. And while other people have got to the end of the stage of reaching grief, it still takes its toll on other people. It still takes people longer to get back on that process, back on track to where they were. And another thing is relationship breakdown. Now, yeah, relationships is a huge part as well. If you're diagnosed with a chronic or life-threatening illness such as coronary heart disease or cancer, or all those low parts of things that unfortunately a lot of young people have to have as well, unfortunately that can lead to a lot of mental health problems. If you're vulnerable to depression due to certain personality traits like low self-esteem or being overly self-critical. Now this right here screams to me, self-critical. Now, I am my worst enemy. I hold my hands up there. I am my worst enemy. I know that I am. I'm terrible with it. I've always done it, and your life just hits a point. I was alright until a certain age where I thought, hold on a minute, it's time to start getting real. It's time to start growing up, and when you go through that little phase when you're younger, you think you're all just because you're getting older than some of your classmates, you start being a bit overconfident. So actually becomes an obsession, and you actually become overcritical. So this may be due to genes, or have been inherited from your family, blah, blah, blah. You don't need to read any more into that. Or having a history of depression. Once again, I'm not going to read too much into that. If you're cut off from family and friends, social isolation may be a risk factor for depression or a response to feeling depressed as a downward spiral takes hold. Now that is important. If you start keeping away from other people and don't have that social interaction, you're gonna be having a lot of problems. You're gonna start suffering with depression, or maybe not depression, but because depression is one extreme to the other, to just feeling unhappy and lonely and wanting to be alone. It's all different things. But if you are cut off, you're not likely to have those conversations with people. You're not likely to talk about it, and it's meant to remain in here, and it's not actually coming out. And the last section I would like to read out today: getting help as soon as you think you may have depression may prevent your depression getting worse, but that is not set in stone. So as I know, mine's got worse since my diagnosis, but that doesn't mean that's the same for everybody. It's impossible to tell. It is impossible to tell because everybody's different. The exact causes of depression are not fully known. It seems more likely to occur if there has been depression in the family. Having a relative with depression does not mean you will necessarily become depressed yourself. Furthermore, there is a number of lifestyle factors influence in the world around you that may increase the risk of you developing depression. And mental health, although GPs are able to help most, which a lot of people question what's a GP, and I know if you're in the US, a GP is a general practitioner, and that's a doctor. So a professional doctor, qualified doctor, 5-year student, graduate. Although GPs are able to help most people to manage depression, for some people, particularly those with more severe depression or where treatment is not successful, more specialised care may be needed. Now, I work on a ward where patients, obviously, this is all highly confidential, so I'm not going to be mentioning any patient names or anything like that. All I can say is I do work in a section, in a ward where they are sectioned, where they are taken away from their home because they're at risk to themselves. or other people, and they go there because that's the final resort. Their depression is so far down the line. Unfortunately, they're on their own and they haven't got many people to help, and GPs can't be there 24/7, whereas the ward, we can be there 24/7 because there's always a staff member there. So that is why people get detained and then put on what's called a section. I might talk more into that on another day, but yeah, that's the line of work that I work in. Believe it or not, it's helped me with my depression as well. A lot of people think it's a good thing that I work in mental health just because it helps me understand myself. I'm very good with the patients. I get told that I am very good with the patients just because I know what they're going through. Now, when I say I know what they're going through, I don't mean it in the state of what their mind's chattering, and I just know how that might feel. I can't know exactly how that feels, but I just know how that might affect them. And I just know it's going to be incredibly tough, but I can't presume to know what their thoughts are, and how their body and minds react to things. I couldn't possibly know that. I'm not psychic. I don't know these things. So yeah, that's today's video. I'm hoping these will become regular videos, something that I can just put interest into. This is what I'm passionate about. This is my job. So wouldn't it make sense to show everybody else what I'm passionate about and just go from there? So thank you for watching, and I will see you in the next video. Goodbye for now.